My name is Melanie Mondello. Oh, sorry, I'm going to start that again. Sorry. Hi, everybody. We are going to talk today about the Rhode Island Continuum Care System Planning and Operational Responsibilities. My name is Melanie Mondello. I work for the Technical Systems Collaborative. Most of you just know us as TAC. And today we're just going to go through your current local structure and talk about how you can be part of that with your agency role or if you're coming with lived experience with that role. So we'll go to the next slide. Here's our agenda for today. First, we're going to talk about the function and the structure. Then we're going to talk about what a CoC has to do. So I'll use the term CoC throughout the day, which just means continuum of care. Then we're going to wrap up with talking about how you will have opportunities for participation, you and your staff within your teams that work in the homeless system. And at the end, we will do some questions as we go forward. So next slide. What I'm hoping that you get out of today is having that general overview about roles and responsibilities in the structure so that you can better decide where you fit, where your staff fits, where your program fits in the overall system. And then as important, really thinking about how you can participate in the structure to add value to the planning for the homeless response system in Rhode Island and how it can respond to different funding opportunities and needs within your community. So we're going to do next slide. I know some of you, but not all of you. So if you could go ahead in the chat, introduce yourself, your name, the organization that you're representing today, what your role is, and then just for my sake, just tell me a little bit about how long you've been part of the CoC planning process. That way I can get a sense of how many people are new to the process and how many people have been doing this for many years. If people want to just pop that in the chat, that would be great. While folks are doing that, I'll just go over a little bit of housekeeping. Today we're in the Teams profile. If you can keep yourself muted until we get to questions, that would be great. The Rhode Island Housing team is behind the scenes and they'll help with any tech questions that you do have. We're going to use the chat for introductions, saying hello to each other, and then we're going to use the Q&A if you have any particular questions that you want us to get to at the end. So if you can do like the conversational things in chat and the questions in the Q&A feature, that will help us not miss anything as we go forward. Okay, I see some folks typing. I'll share a little bit about myself while you guys type in this. Like I said, I work for Technical Systems Collaborative. I've been there over 15 years. Before that, I was a balance of state chair and worked within a mental health agency that ran statewide housing programs. So I've been in this work a really long time and excited to share with you today and hear your thoughts on how you want to be part of your CoC. Okay, so 4 years. New folks to the board, great. Thank you, Elizabeth. Okay. Nicole, my colleague from TAP, is going to be launching some polls. So we'll go to the next slide. We wanted to kind of start with a fun activity and get you used to the platform that we're using today. We're using Mentimeter, which is menti.com. So I'll pass it over to Nicole to tell you how to log in. We'll get that set up and we'll be using this throughout the presentation. Nicole, I'll pass it to you.
Thanks. Hi, everyone. So just a fun way to make this training a little interactive. You can actually use any web-enabled device. So if you want to pull up your phone and scan the QR code, you can do that. If you're using your laptop and you want to just type in menti.com, then you can enter the code 8153-3977. And it will actually take you into, you'll see exactly what I am screen sharing at the moment. So if you could come along with us and log on to Menti or just scan that QR code, we'll get started with a question just to make sure that everyone is able to access Menti, and then we'll use it throughout the presentation. I see some more people liking, so I'm assuming. I don't see anything in the Q&A or the chat, so maybe can people give a thumbs up on Teams in the React if you're good? All right, I'm seeing some thumbs ups. And someone typing, so maybe you're having, give it one more second. Okay, all right, so just for fun, what national day is today? So is it National Get Over It Day? Is it National Promposal Day? Or is it National Girl Scout Day? So go ahead and select your answer. And down here in the right-hand corner, can see how many people have responded. So there's roughly 15 or so of us here. So I'm gonna hope everyone is gonna choose to engage and select what day they think today is. And while we're doing that, if anyone is having any problems, just come off mute and we can help problem solve so you can get into the Menti, because we are going to get into some more content specific questions shortly. All right, we've got 10 of 16. I'm going to call that a success, Melanie. And the drum roll for the answer is, it is National Promposal Day. Something I didn't even realize was a day until we were getting ready. So those of you maybe with young children that are getting ready for prom, hope they're having fun today. And if you just stay in Menti, whether you used your phone, your web-enabled device, you'll just see us step through the slides.
Perfect. Thank you so much, Nicole. And again, if you have any tech issues, just put them in the chat and we'll do our best to support resolving those. So to get into the meat of the topic today, we are going to talk about the continuum care function and structure. So Nicole, can you go to the next slide? First, I wanted to talk about just what is a continuum of care. So continuum of care is a required planning body that the Housing and Urban Development Hub Office, through the CoC program rules, requires communities to be able to access funds for housing programs, service programs, HMIS programs under the CoC program. So the CoC is a group of people who is working together to develop a system-wide strategy to prevent and end homelessness. That can look different in many states. It evolves over time. It's evolved over time in Rhode Island. But the key is that there's a structure, there's a way to make decisions together. It's a transparent process where people can join and understand what roles they can have, how to be a participant, how to be a member, how to be a part of the board. So for CoCs, really some of the guiding values are focusing on housing, right? If you're trying to end and prevent homelessness, having this housing focus is key. The continuum of care as a group does not control all of the housing funding sources for the state, but they partner and work together to meet any unmet needs that have been identified by your community. So thinking of the CoC program itself, the projects that are housing related, thinking of your mainstream resources like housing choice vouchers, formerly Section 8, thinking about any properties that you have that have dedicated units for people that are trying to exit homelessness, that type of thing. Another guiding value that your CoC and many's have is designing a system to make sure that the most vulnerable populations have access to the resources. So thinking about people with lower incomes, thinking about families that are fleeing any type of domestic violence or violent situation that they're living in, any BIPOC communities, all the vulnerable populations that don't have access to the resources to move out of homelessness and into housing without the services and maybe housing subsidies that your system can offer. The CoC structure was also created and required to make sure there was a community-wide strategy before CoC is formalized. Sometimes it was each agency or different groups of agencies coming up with strategies, and there's just with the number of resources that you have, ensuring that there's a community-wide strategy that can help implement the resources that are allocated is really important. Another guiding value of CoCs is to look at system performance and use the data from your projects to inform what the system performance measures should be and to improve the performance. How can you get people out of homelessness quicker? How can you create more housing units? How can you help people remain in housing units? What type of resources do you need and what type of data are you collecting about how many people are getting income versus from employment versus benefits, so that you can understand how people are moving through your system. There's also, as part of the CoC planning, you're also going to be working with your mainstream benefit program partnerships. You can think of any temporary need to assistance, anything that was part of the food stamps or SNAP programs, all the things that support people with lower incomes to get stability and income resources to move into housing and stay in housing. Okay, we'll go to the next slide. So who is part of your Rhode Island Continuum of Care specifically? We'll go to the next slide. This is the variety of agencies that are participating in your CoC. Some of them may be heavily represented, like providers of social services, typically make up a large part of a CoC membership. Other entities like law enforcement agencies may come and go in their membership or be part of subcommittees or work groups. But at its best, right, at our aspirational goals, these are the types of organizations that you would want to see in your CoC. Because educational institutes, there's a definition of homelessness for children. So you want educational institutes there so that you're understanding how many families are experiencing homelessness and how many people under 18 are experiencing homelessness. Health facilities, they're a key partner too, right? Emergency rooms, shelters, homelessness, we all work with the same people, even though sometimes we're very siloed. So this is the, again, aspirational goal of all of these folks should be on your CoC board or membership in one way or another, so that you're really understanding the flow of who's in your system and who needs help understanding the different programs and how you can educate each other on the different programs that you use. Okay, we'll go to the next slide. So how did you structure yourself? HUD says you must have a structure. You then create that structure and modify it as needed. So this is a slide from your CoC staff about your current structure and the current committees that you have. So you have the general membership, which, and you'll see a lot here, sorry, Rhode Island RICoC, just means Rhode Island Continuum of Care. So you have your general membership, which is made up of agency staff, people with lived experience, possibly some, elected officials that are part of the process. That general membership then populates the rest of the boxes that you see. So you have your Rhode Island CoC Board of Directors, and we're going to talk about how they're elected, what the terms are, kind of what your meeting rules are. And under your Board of Directors, they create and authorize different committees and working groups. You can see here we have 9 different current committees and work groups that are part of your Rhode Island structure. You have an equity work group that is working on making sure that all folks can access the programs that you run specifically with the CoC, that you fund each year, and your partners in the community. You have the HMIS and system performance work group. HMIS stands for Homeless Management Information System. That's the data work group, and the group that's looking at all the information that you put into your data system that we're going to talk about and bringing that back out to help inform new programs, technical assistance and trainings that you need to offer for folks. You have a funding recipient approval and evaluation committee. You have a governance committee. So again, today we're really talking about the structure. There's going to be a change to the governance structure of the Rhode Island CoC. That committee would work on that and give recommendations to the board. You have a grievance committee in case there's a conflict at any of your programs that are implemented. Coordinated entry implementation. Coordinated entry, for those that don't know, is the front door to the homeless response system resources. So there's a committee there talking about how people can access the committee, how to improve access, where the kind of bottlenecks are, and how to get more programs participating in that so you can connect people with the resources they need to exit homelessness. You have a pipeline committee. You have a youth action board, which you'll hear referred to as a YAB committee. That was part of your YHDP, your youth homeless demonstration program award that Rhode Island got to build programs specifically for young adults. And then you have your constituent advisory committee. People can be part of one or many of these committees and work groups. What's important is to know that they exist and then work with you and your staff to see how you can help support these activities. So we'll go to the next slide. So as part of your Rhode Island Continuum Care structure, you have a governance charter. That's a required document so that everybody, again, transparently knows how you organize yourself and where they can participate and how they can participate. So this, again, is an excerpt from your governance charter. The board of directors, as it's structured right now, are elected from your membership. So the membership committee, you have agencies that participate. Each agency would only get one vote. So if Nicole and I were part of your CoC and we both went to a meeting, only one of us would be voting on things like who's going to get placed on the board of directors. The membership also approves the governance charter. So if there's changes, the committee would process that, bring things for discussion to the different groups, and then there'd be ultimately a vote on that to implement or not implement the suggestions from the membership and the work groups. In Rhode Island, you have at least 4 general membership meetings a year. So if you want to be part of the general membership in those meetings, that's the commitment that you would be making to be part of that. And again, it can be one person from your agency, or you can swap that out depending on the topics and who needs to bring their expertise to the table. And then as part of the continuum care structure, HUD does require, and Rhode Island Continuum Care does this, that you have to invite new members annually. We all live in this work day to day, but we need to remember to reach outside of ourselves and outside of our systems to make sure that if there's been turnover from a key partner, if there's new agencies that started, just making sure that we annually invite new people to be part of the process so that we can stay up to date and current with what's going on and what the needs are. So we go to the next slide. So we're going to talk a little bit about the board of directors structure. Right now, it's a 17-member board of directors. That's what's required based on the governance charter. This is also something that evolves over time. So when I say right now, it's because as of today, this is what you look like. There's subpopulation representatives. So that could be people from mental health agencies. It could be people providing substance abuse services, domestic violence, all the different populations that are working with people who are trying to either avoid or exit homelessness. 3 people with lived experience of homelessness. This is really important to make sure that you're bringing in the voice of people that are going to be using the services. So that way you design something that's functional and useful, not something that looks really administratively wonderful, but doesn't meet the needs of the people who are trying to exit homelessness. Recently, when you got your YHDP award, you added 2 seats for the youth action board members. So taking from that YAB committee, having people come up and bring that voice directly to the board of directors to be partners in decision making. Homeless service providers, of course, in the response system development. 1 person from the Rhode Island Department of Housing, an individual from the philanthropic organizations that are serve you, and an individual from one of your municipal public housing authorities. So the structure that you have is supported by, for your board of directors, is also supported by these key lead agencies in the state. And I just wanted to go through each of them because, especially in a state in Rhode Island where you're a statewide system, people may have multiple hats, right? You might be on the board and also part of HMIS lead staff, right? You're going to have multiple roles. And it's really important to know kind of what your role is at any given time and help explain to your staff and your decision makers where votes happen and who has control of what. So within Rhode Island, you have what kind of 4 key lead agencies or entities. The CoC board, again, we just kind of talked about their structure a little bit. They're the designated group that's acting on behalf of the full CoC. The governance charter sets that. They set the rules for who's part of that board. That board is the one making decisions for the CoC because they've been given that role. Underneath the board, you have support agencies who are implementing the program, who are getting tasked with assignments that the CoC wants to do or has to do based on federal or local initiatives. So you're going to hear the term collaborative applicant thrown around in your work. This is the designated agency that the CoC picked to carry out activities that it assigns it. So the collaborative applicant at a minimum is the one putting forth your annual application to HUD, organizing that process in partnership with the CoC. They're the ones that are actually hitting the submit button. They're your to get your planning grant. Right now they have 2 dedicated staff that are CoC planners that help organize your meetings, bring committees together, all of that structure stuff. You also have an HMIS lead, and again, HMIS is the Homeless Management Information System. This is another designated agency. They are designated and chosen by the CoC to oversee the HMIS management and system administration. We'll talk more about the HMIS system as we go along. There's also a CES lead. So you have 2 leads in Rhode Island. So CES is just an acronym for Coordinated Entry System. Again, this is a designated agency. So the CoC designates the CES leads in your community, and their job is to implement and then administer the Coordinated Entry System. And again, just as a refresher, and there'll be more information on this as we go forward. Coordinated entry is a coordinated front door and intake and resource providing structure to help people navigate the myriad of options that are available in your homeless response system. So I think the key thing to take away from this slide is the CoC designates different groups to act on its behalf. And that is a process that is outlined in the structure. So if you ever wonder, like, how do we get a collaborative applicant? How did Rhode Island Housing become that? What did we do? How do we pick our HMIS lead? How did we do all of this? All of that is in your governance charter, but these are designated agencies that were chosen by your group. So, okay, we'll go on to the next slide. So there's some general responsibilities that HUD gives to CoCs if you want to apply for annual funding and get annual project awards. I'm going to go over what the general CoC responsibilities are, and then I'm going to specifically talk to what in Rhode Island, how you divvied up those responsibilities. So a CoC in general, any CoC that exists and applies for CoC program resources, they have to have a governance charter. They had to create one, and you also have to update it annually. And again, that process will go through your committees, up to your board, and then to general membership for input. You also have to have a written process, that transparency piece of this, to select your board, to select your HMIS lead. That way people know how you got there. And if you ever had to change anything, if things shifted in Rhode Island, you would know how to do that again. You also have to hold the full membership meetings. We talked about you have at least 4 of those a year in Rhode Island. Inviting new members, a little bit of a no-brainer, but it is a requirement that you have to actively invite new members at least once a year. It can be more than that, of course. Going to number 5, another responsibility is to develop what HUD calls written standards for the CoC, Continuum Care Program, and the ESG, which is Emergency Solutions Grants projects. And written standards is it's a document and policies that say, like, in general, this is how we're going to run our PSH program. In general, this is how we are going to run our RRH or rapid rehousing programs. It sets some basic core standards for how your CoC's values and your CoC's requirements for how people will conduct their programs. There may be in your written standards some very specific things about different methods that you need to use to, like, for rapid rehousing, like how you're gonna calculate your rent. So those written standards are really important for if you're a project wanting to apply for funding, if you want to create a new project. And it's really important as you're onboarding new staff for people to understand the written standards, because the written standards are at this big global level for the CoC. And then you as a project are also going to have your program manual or your admin plan. And those have to align with these written standards that the CoC is responsible for creating. You also, as was kind of a teaser before, have to create a coordinated entry system, and that's why you have coordinated entry lead agencies. The coordinated entry system in Rhode Island is the front door for shelter referrals. They also make housing referrals if there's an opening in a PSH, permanent supportive housing, or rapid rehousing program. There's an assessment, an intake assessment, and prioritization process within the coordinated entry system. So as a CoC, you create that system and then you designate someone to actually implement it on the ground. And then the feedback loop goes through the committee that you saw listed earlier. Number 7 is really important also. It's a big part of having a system-wide look at how money is being used and how effectively it's working to end and prevent homelessness. So the CoC in general has to set performance targets for the projects that are funded with the CoC and federal ESG funds. They're also responsible for monitoring the performance of those projects. And then last but not least, you have to take action against poor performers. So if there's a project that is not fully implementing the project, if there's a project that isn't fully enrolled, that is something you need to work with them to either reallocate the funding to another project or help them fix the program model, the design, understand the system, understand how to get referrals. So all of this, number 7, the setting performance targets, monitoring the performance, and then taking action, those all rely on data from the coordinated entry system as the referral source to different projects, and data from your HMIS, the Homeless Management Information System, about, like, how many people are getting income, how long were they in housing search before, after they were admitted to the program, how long are they staying in the program, are they exiting to successful placements like housing of their own or housing with another type of voucher support if they need the income support. So these are really key roles, a little bullet that creates a lot of work and a lot of the structure that you're going to hear about today. Okay, next slide. So specifically in Rhode Island, of those responsibilities, these are the ones that you've designated to your board. Anything that's not here is in the general membership or committee purview, or it may have been designated to the collaborative applicant. So for your board responsibilities, policy changes are at the board level. So you have the work groups that are creating the policies, and then the board is approving or denying those policies and working to make sure that if the federal government has a rule change or a new requirement or a new initiative, that you're in line with those so that you're okay to get your funding every year. The CoC board, with the help of the planning staff, also hosts the full membership meetings and board meetings annually. It appoints the committees and work groups. So I'm sure there's a lot of discussion within your CoC about what's needed, but for a committee or work group to formally be part of the chart and be part of the structure, that would be the board decision to create that role and make sure that there's a feedback loop between that group, the board and the general membership. Establishing and monitoring performance targets, again, a board responsibility that they share with the committees and the collaborative applicant staff to create that structure and make sure that there's input from the community and that it's published and clear what people need to do to be successful at implementing a CoC program, and then in partnership giving feedback to the ESG, the Emergency Solutions Grant programs, about different performance targets that would be helpful on that side. Overseeing coordinated entry, establishing funding priorities, typically based on the performance and the gaps analysis. And then last but not least, submitting the application to HUD for the program projects, the CoC program projects that your community has created, ranked, prioritized, and annually submits to HUD. So that's an overview of the board responsibilities, how you've kind of structured it within Rhode Island. Next slide. So a little bit about how you do this. We'll go to the next slide. So for the board process, if you're already on the board, you know how this works. You just went through it. But if you're interested in being on the board or you just want to know more about how the structure happens, this is a good kind of go-to slide. There's more details in your governance structure about this, but in general, your Rhode Island board process, it's 2-year terms. Up to 6 years, people can have for a term, having 3 terms in a row if they want. Those can be consecutive, but they are 2-year terms if you're looking at being on the board and going through that process. The board meets at least 5 times in a year to do all the duties that we talked about on the previous slide. They may meet more, they may have special meetings. Special meetings can be convened, as you see here, by the chair, or if 30% of the members want there to be a special meeting of the board, you have a process to be able to do that. It sets a quorum as the majority of the board members. Issues are decided by the majority of the board directors that are present. And we're going to talk a little bit about the Rhode Island Open Meetings Act and how that informs how you stay up to date on when meetings are happening, where they're happening, and then the agenda and the minutes from those meetings. Okay, we'll go to the next slide. So this is just a little bit about, again, a summary slide from your CoC orientation materials about the Rhode Island Open Meetings Act. You'll see on your Rhode Island CoC website, which I've linked down below, information about your board meetings. You'll see information about general membership meetings. The Rhode Island Opens Meeting Act means that public can attend these meetings. It means that if there is going to be a meeting of the CoC entities, then you have to provide advanced written notice so that people can choose to attend. That written notice should include the date, the time, the agenda. So again, you can send the right staff at the right time to the right meeting. There will be minutes after that again are published, and those are available on your CoC website. And they do allow for recording a meeting. So again, these are Rhode Island specific rules, but it's just good to know if you're part of the committee structure, part of the board, or part of the general membership implementation. You really have to think in advance, set the schedule, make sure that people can participate if they want to. You don't want a situation where you're having a meeting at the last minute, you're not talking to people about that meeting, and then you don't have the right people there and people can't opt in. So it's really important that you think in advance about those meetings and make sure you're working with your CoC staff to properly publicize those. Okay, next slide. There's a Continuum of Care Code of Conduct. This is for board members, but I think it's good information for everyone to know and to think about as you're part of committees, work groups, and for your own agency. A code of conduct is required by HUD for your board of directors. And it really gets to the heart of making sure that there isn't a conflict of interest within your structure and design. As I said earlier, a lot of us wear many hats, right? Like we are not just an agency director and running a program. We might also be on the board who makes funding decisions, or we might also be on a committee that gives input for why funding decisions may be made. So the code of conduct requires that you talk about any conflicts that you may have, that you disclose what those conflicts may be, and that if you need to recuse yourself from the situation, that you do so promptly and follow the process that's set forward. So it's just really important to know that everyone can participate in the process, but you can't participate in a way that advantages your agency or gives you kind of voting rights with something that your agency will then be advantaged by. So an example is if you're applying for CoC program funds, you're not going to be on the committee that is picking the projects which are going to be funded, right? That's inherent conflict of interest. Go to the next slide. Again, something Rhode Island specific here about how this works and what the decision process is around code of ethics and what people need to do to kind of recuse themselves and what it means to have different conflicts. So I'm not going to read this whole slide to you, but it's just important to know a conflict can be monetary. It could be that you're advantaging a family member. So an example of that is you might be a housing provider, you're looking for housing units. You can't only rent from your cousin who has these buildings. They may be part of your landlord pool, but you're not steering all people towards there. If some of your staff are also maybe, I had a situation where one of my staff members actually had an apartment building also. So we had to come up with a way that those units can be available to people, but not in a way where he was inspecting his own units or right, like pushing people towards his own unit. So there's all these things as a small community that works together where you need to think about like, what does this look like from the outside? How are we being inclusive and fair in the decisions that we're making? Okay, go to the next slide. Within Rhode Island, we've talked a lot about the Rhode Island Continuum of Care, the CoC. There's also another planning body, the Housing Resources Commission, the HRC, and we thought it was useful for you to know the differences and the interactions between these two groups because they do work closely together. And obviously, the Homeless Response System is very interested in developing housing, and the Housing Resource Commission, this is what it does. So they work very tightly together. You could see on the left-hand side some of the things that we've already talked about what the continuum does. It has a collaborative applicant to do administrative roles on its behalf. It talks about policy and system planning to end and prevent homelessness. It selects the projects for the CoC program funding. And the HRC committee, it makes recommendations to inform the larger ending homelessness in Rhode Island plan. The HRC committee, that is overseen by your Department of Housing. And you remember they were also one of the board members. So they're integrated into the process. The Housing Resources Commission also oversees affordable housing production in Rhode Island. And the State Consolidated Homeless Fund, CSPHF. My understanding is the State Consolidated Homeless Fund works very much in partnership with the federal ESG Emergency Solutions Grant Program. So those are weaved together within Rhode Island to come up with a comprehensive shelter response system, outreach system. The Housing Resource Commission also ratifies the funding decisions of the Continuum of Care. So those recommendations are made up to the HRC. As we talked about, there is a board position for the HRC within the Rhode Island Continuum of Care structure. So as long as there is no conflict of interest and you've gone through that process to make sure that there isn't, that you're disclosing anything, that could be cross-population with staffing there. And then the CoC can also uplift and make requests of the HRC if there's a particular issue that they're dealing with that the affordable housing community is also dealing with. You may work on things together, or you may elevate topics that have come up for your membership and in your communities and conversations up to the HRC to talk about in more depth based on coming out of just the homeless system and looking at the whole response system within Rhode Island. You will get these slides at the end, so all of this will be available to you, so you don't have to memorize this, but you'll have a place to go to get it in the future. So we'll go to the next slide. So I just threw a lot of information at you. I'm going to pass it back over to Nicole to do a couple Menti slides to make sure you heard what I was saying, and we can just kind of reinforce a couple key issues about how your structure actually implements in Rhode Island. Nicole?
Awesome. So hopefully everyone is still in the Menti. If you're not, you can just go back to menti.com and use code 81533977. Or if you need it, there's the QR code real fast. So assuming everyone is good, I will stop showing the code so you can see. So who votes to elect the Rhode Island Continuum of Care Board of Directors? It's either you can pick from the general membership, all people attending, the board of directors only, the general membership with 1 vote per agency, or the collaborative applicant staff. So we've got about 5 people that have responded. Thank you. Looks like everyone 6 going with the strong vote for the general membership with 1 vote per agency. Hopefully y'all just keep on. Anyone having problems with the Menti? All right, Melanie, I'm just going to move us forward and show the correct answer. All right, so thank you very much for those of you playing along. You all got that answer correct. Good job. So our next question is, how many work groups and committees does the Rhode Island Continuum of Care currently have? You can pick from 5, 7, 9, 11, and we'll give everyone a chance to get their responses in. All right, thank you to that brave person, those 2 brave people. There we go. Getting some answers in. I'm gonna find that 6th person that answered the last time and hope that you can answer again. All right, thank you. So the correct answer is 9. So great job. 3 of you got that right. Melanie went over those 9 work groups and committees. And as she mentioned, you'll get the slides so you can keep up with all of those committees and work groups. And one more question. So which of the following are board responsibilities? So within this question, you can select more than one answer. So we have appoint committees and work groups, find meeting space, establish and monitor performance targets, oversee affordable housing production in Rhode Island. So we are answering to which of the following are board responsibilities? Right, getting some answers in. Okay, so the answer is, all right, so great job, everyone that answered establish and monitor performance targets. Oh, sorry, Elizabeth. I'm assuming then everyone else also knew appoint the committees and work groups. That's a Menti issue on my side. So thank you, Elizabeth. You are absolutely correct. All right, so we will go on into competition for projects. And I'll just advance us to the next one, Melanie. Is that okay? Very good. All right.
Thank you, everyone. Great job on the polls and the questions there. So next, I wanted to talk about one of the key roles, as you heard, of the CoC was to have a annual competition. It's going to be every 2 years now, but typically it was annual before for Continuum of Care program funds. So it's a year-long process in that you are doing your monitoring, your data collecting, talking about needs for your community, talking about how your needs align with the federal government's funding priorities and kind of how you want to use the different buckets of federal money. So it should be a year-long planning process because you'll have your overall system plan, and that plan will inform these steps of your continuum of care NOFO competition. So NOFO stands for Notice of Funding Opportunity. I like to present it this way because there's 5 key steps, but within these 5 steps, there are many, many other steps. A lot of your meetings around the time of the competition will be very focused on these steps, talking about what you want performance measures to be, what types of projects you need. Do you need more permanent supportive housing? Do you need rapid rehousing? Do you need more HMIS, coordinated entry? All of those things based on what HUD is allowing in any given year. So each of these looks really simple, but there's a lot more behind this. Your meetings in Rhode Island, though, are more than just the competition. So I just want to say that if you're joining at the time of competition, it can feel like that's all that we talk about in a CoC meeting, but there really is more beyond that. So if you're going to be part of the CoC, joining year round is really helpful. So as part of the competition basics, they're setting funding priorities. HUD always outlines their priorities. Of those priorities, your CoC has to determine which ones you're going to implement locally. You'll create a process for letters of intent to be submitted by agencies that want to do a new project. You will look at your gaps analysis and your housing inventory charts to see what you need. You'll develop a whole RFP, a request for funding proposals, to be able to sort through like what are the proposals that people are willing to do, and then which of those does the CoC want to implement on at any given year. So HUD opens the NOFO competition once a year, twice now for this next couple of years. And renewal projects that you already have existing in your community, as well as any new programs, have to comply with any requirements in that notice of funding opportunity. And I say that way because it can be very confusing for CoC projects. And as you're onboarding new CoC board members and general members, to understand what the rules of the road are around CoC Continuum of Care projects. So the Continuum of Care program has a set of regulations, but the notice of funding opportunity, that NOFO, can add additional layers. So in the regulation, I'll give you an example. HUD allows permanent supportive housing as a project type to any eligible homeless population. But typically in the past, the annual NOFO has said, yes, you can absolutely do permanent supportive housing, but for this subpopulation, people who are experiencing chronic homelessness. So you have to take your regulation and that NOFO for the year that you were awarded and the year you're competing for to really understand what's allowable in the project design and what you're going to have to implement. After the competition opens, we understand what the federal priorities are and what your local priorities are. There's a whole process for applications, new and renewal. That would include ranking, that will include scoring, that will include the performance measures, like how did you do, getting people housed, keeping people housed, getting people mainstream benefits and incomes. There's a whole process. Number 3 expands into about 15 different steps. Also part of the process, and this is a big part of where your planning committee comes in, is there's a community application. They call it the CoC application in the software system. This community application is where you get to brag about all the work that you've done year round in creating your homeless response system, telling HUD about what outcomes that you had, and telling HUD sometimes they ask what your future plans are too. Some of these questions are data, so they're coming from the HMIS system, they're coming from tallies of membership, they're coming from meeting minutes, depending on what HUD's asking for in any given year. But a lot of it is describing the community response. So describing how you work with ESG fund, those emergency solution grants. In Rhode Island, those are linked with your consolidated homeless funds, right? How do they work together? Not everybody on the CoC is going to have intimate knowledge of how you're using those funds. That's why you have to have such a broad general membership, so you're understanding how everything works together. And at this point in time, you're feeding all the information back to the planners to be able to compile it and put your best foot forward to be able to compete for funds. It's a very competitive process each year. So you'll hear your CoC board and your collaborative applicant and your HMIS teams would talk about data quality, responsiveness to requests to complete data or fix data, responsiveness to implementing your project in a timely manner, using your project, right? Full utilization of the resources that were given to anybody at one point in time. So all of that is important because there's also questions about how you work with the Department of Education, what their system looks like. So you really have to talk here about the partnerships that were outlined earlier on like how you design your board, and then how you involve a variety of community members, not just the providers for homelessness, for homeless programs and programs that have services for people experiencing homelessness. It needs to be much broader because that's what HUD is asking. One, it's effective, and two, that's what HUD is going to ask and score you on. So, and then last but not least, that's all submitted to HUD through a platform called eSnaps. Again, all of this is written out by your CoC each year. So we will know how much money is available, where to go to get that, and then how to submit an application. And then the award process comes out. And as a community, that's shared. And then you go ahead and implement those programs. So these are some of the basics. And you'll see some of these titles look like some of your committee and work group structure, right? Like kind of how your structure got created is in response to some of the CoC requirements and the process that you have to go through. So this could be its own full day training. So we're not going to go into that now, but know the information about your competition is on the website, the Continuum Care website, and it's updated annually. Here's a little bit about what your competition has looked like in the past and how you structure going about awarding different projects. So again, the Rhode Island Continuum of Care is in charge of this process. You have your collaborative applicant staff to help support that process. Right now, you use your CoC funds to do permanent housing, which is the permanent supportive housing we talked about, and the rapid rehousing projects. CES is coordinated entry. That's the front door. That's the intake, assessment, prioritization, and referral system for designated homeless services. You have HMIS. You use part of your funding to support the data system that is required by HUD to gather data from projects. And you have a planning grant, which supports your CoC planners and some other activities. At last count, it was about $17 million annually that is managed through this competition and goes to those different activities. New projects are very competitive process. Right now, the only way to get new projects within a CoC is if HUD allocates bonus funding for different initiatives like permanent supportive housing. There have been in the past domestic violence bonus funds that specifically support people who are fleeing a violent situation. And the other way that new projects are funded is something called reallocation. So a project can voluntarily say, this project isn't working anymore. I'm going to give this money back to the group and we're going to repurpose it. There's also a process for involuntary reallocation based on those performance measures. If a project doesn't fit anymore, they're not able to kind of get the outcomes that you want for people in Rhode Island, maybe that money is reallocated and then it goes in the new project bucket to be competed for, like we just talked about. So everything that you're doing in the competition and hopefully annually is to increase the resources for people to exit homelessness and increase the efficiency and outcomes, positive outcomes that the programs are getting for folks. It's never the goal that everybody is 100% in everything. Your performance goals aren't meant to screen people out. They're really meant to just understand, like, within the structure and resources you have in Rhode Island, how can you best implement your permanent supportive housing and your rapid rehousing? As a CoC, you receive a score from HUD. Each project isn't scored, they're ranked, but the CoC is for the whole continuum of care. And then HUD just goes down in point order, right, across the nation. And the higher your score, the more likely you are to get all of your renewal projects and hopefully some new projects as well. Okay. Next slide. Okay. I wanted to kind of break out here 4 projects, whether you're creating a new project, you're expanding your current project, or you're renewing a project. Maybe you already have something in place and you're putting in for renewal. One to separate out what the CoC has to do and then what the agency has to do. The CoC is responsible for hosting, providing information about the rules of a competition, the types of projects they want to see, and how they're going to be scored, ranked, and submitted. So the CoC has the structure. The CoC in Rhode Island also has resources to help you understand some of the operational requirements. There's a web page that has written standards. It has sample guides that you can look at your program policies to say, like, okay, I got continuum care money. What would I have to do with it? Like, how do I do rank calc? How do I do inspection? All of that. What's the financial management? So CoC is responsible for this really high level structure and coordination of the process and resources to the extent they can. The agency is responsible for understanding what is eligible under the CoC program, because every year, typically in CoC, someone applies for a shelter under the CoC program, but that's not an allowable project type under CoC program. Those shelters are funded with other funding sources in Rhode Island. The agency also needs to review the unmet needs that it knows about and that the CoC has identified to make sure the projects that you're proposing are going to meet a need in your community. The Rhode Island CoC has a process for letters of interest to be submitted if you want to be considered for a new project. As a renewal, as a project existing in your community, you also have to submit your renewal project applications. I have seen places where people forget to submit the renewal project applications. So I wanted to call that out explicitly. You get the money, but you have to apply for it during each competition based on the rules that your CoC does. And you also have to implement the project. Again, kind of saying some obvious things here, but it's really important that you understand what HUD expects of you and what your CoC expects of you so that you're implementing projects correctly and in a timely manner. Because if you don't implement your projects, if the agency doesn't understand what the process is and how the CoC works, you could lose a project accidentally. You could have a project that gets its funding withdrawn, and that doesn't always go back to the CoC. That just goes back to the general budget. And you don't want to lose funds for Rhode Island. So I just thought this was really helpful to figure out, like, what the CoC is going to provide and what the agency is going to provide within the CoC structure and on that CoC webpage that I was talking about. We'll go to the next slide. Okay. So here again is an excerpt from the orientation materials about how you need to structure the competition. Some of this I've already talked about, but I think it's just important to reinforce that this is a public open competition. You have the Open Meetings Act where people can learn about it, but HUD also requires that it's a public process. It's not something that just the board of directors knows about and people that they have a relationship with can apply. It's everybody that should understand what this process is and that you're advertising that. We already talked about ranking the applications, and it is good just to reinforce it's really only the highest scoring CoCs across the nation that have been getting new projects. So it's really important that you lend your expertise to be able to fill out that community-wide application. So you're getting credit for all the hard work you do and putting your best foot forward. Okay, I'm gonna go next slide. So just one quick question here, make sure we have everyone with us still. Nicole, I'll pass it back to you.
All right, so what is the current funding level for the Rhode Island Continuum of Care? 29 million, 17 million, or 8 million? I should have put some like Jeopardy music in while people are answering. All right, we're getting our average number of responses so far. Everyone is voting at 17.
Oh, Nicole, you went on mute.
I hit the wrong button, pardon me. I said we are getting our average number of responses and everyone is at 17.
Oh, you went on mute again. Sorry.
I am looking at my other screen and accidentally hitting what I think is the enter button and it's muting me. Pardon me. Great job, everyone, at 17 million.
Thank you, Nicole. Now we're going to pivot into utilizing data and talking about some of the ways that your CoC collects data and then puts that data out to HUD and the community to be able to use. And then we're going to talk about partnership opportunities, what role you can play in your CoC, and kind of how to continue to recruit and participate in the whole process. So how does the CoC use data? The CoC is required to use data in a few ways. And then at the local level, you will use that data also for local planning decisions, statewide planning decisions. But right now, the data you're collecting really talks about the current housing stock and the number of people that are experiencing homelessness. Those are two things. And then it's a lot of your project data, right? The actual projects that are implemented on the ground. And any projects that are required by their funders to also participate in the HMIS system. So everybody who is required and some optional some people opt in to putting information in your homeless response system software. Currently, the Rhode Island CoC uses Clarity as its system software. Basically, within that program, you can export out the performance measures. HUD has national performance measures that it scores your CoC on. All of those performance measures, all that data is based on what your end user who's at your project level submits. So I always like to say your person who types in your HMIS data has more power than they think, because they literally inform the information that's going to be exported to HUD about your CoC-wide performance measures, and whatever data is entered also is used during your annual competition. So it's really important to support whoever's doing your data entry and then supporting them to be really accurate in that data. So again, you get credit for all the hard work you're doing. The CoC also submits data to HUD for the required reports. There's an annual PIT count, which is the point in time count. There is a document called the HIC, the housing inventory chart, where you look at how many shelter beds you have, how many housing beds you have, so you can see the people that are experiencing homelessness to the need. You also use this data to monitor the projects to see how you're doing as a system and how to help people all do better. So it could be one program that's doing amazing at getting everybody income, right? They're getting job placements, they're getting mainstream benefits, Social Security, and there may be another program that isn't doing as well on that. So part of what you do with your data is you look at it and you understand, is there a difference because of the program design and we expect that difference? Or is there a difference because of a practice that we can have a project share across all projects to get everybody, lift everybody up, right? With connecting people with income, keeping people housed. So you can really look at that data, pull that data and say, okay, is this by design? Do we expect a permanent supportive housing program, which serves people who are experiencing homelessness and have disabilities? Their number of people with employment income is going to be naturally less typically than a rapid rehousing program. And a rapid rehousing program is also permanent housing, but you don't have to have a disability per HUD to access that. So the outcomes may be different. So it's comparing apples with apples and then seeing if there's any strategies that can be kind of shared across projects to make everybody better at this. We'll go next slide. Okay. Talked about this a little bit, the housing inventory chart that you have to do each year, your point in time count, and that is counting people who are sheltered. So that would be sheltered in emergency shelter beds in your state, transitional housing beds that are dedicated for people that are homeless, and people that are unsheltered. So people living out, people interacting with your outreach teams, people who haven't entered the formal emergency shelter system yet. You're going to take all this data and you're going to do a gaps analysis. So basically, again, you take the need, you take your resources, and then you're talking with people who are in your projects, you're talking with people with lived experience on your board and in your membership to say, okay, what do we need? We have a finite amount of money. How do we want to spend it this year? Are we going to continue spending on these projects? Do we need to pivot a little bit to meet a new need? Or is there a new local funding source that can do X and you're going to do Y instead? It's a very dynamic process to make sure that you understand the flow of people through your system and understand, kind of what you're currently funding and how they're doing. We'll go next slide. I alluded that some people have to participate in HMIS system, and there's some people that are optional. In Rhode Island, these are the people that have to participate in the Rhode Island HMIS system, which again is a software platform that you type into for your project specific data. So if you have any of these sources of data or funding, you will be participating in HMIS. You'll want to understand their process, understand where that data goes. If you're thinking of applying for these in the future, you also want to understand the process, understand what the data collection requirements are, and how that data that you're entering impacts the national competition that your CoC participates in. Okay. We'll go next slide. So we talked a lot about the structure, the responsibilities that you've taken on locally and that you have been designated to you by HUD, and how you do all that. So now we want to talk about the so what. What do you do? What are the opportunities for your agency, your team, maybe yourself, to actually participate in the CoC? We'll go to the next slide. The first thing I like to talk about is, why do I need to connect at all, right? Like if I'm the local police department, like why do I need to participate in the CoC, right? Like why am I supposed to be there? If I'm a mental health case management service agency, like why do I want to be part of the CoC? So part of why you want to participate and understand the process and give your expertise is because there are certain services that the CoC controls, and you need to know how to access those and help inform how the people that you're serving, who may also be experiencing homelessness, have access to the specialized services they need and access to the general services that are available in Rhode Island. Also, you want to be able to give feedback. The board of directors is a finite group of people. The membership is probably an ever-changing, rotating group of people. And not everybody can know everything. So making sure that you're in that CoC to provide feedback, to provide facts, bust any myths, understand how you actually do really overlap with the same people, and how you can maybe streamline programs for people. It's really important that you're part of those policy decisions and that you're bringing your expertise to the table. The other reason to connect with the CoC is you have a lot of turnover. So if you're a program manager for a supportive service program, whether it's CoC funded or another resource within Rhode Island. If you understand what the CoC controls, the housing inventory that they have, the number of people that are experiencing homelessness, you could be part of the voice that's advocating. And more specifically within your team, you can help onboard and train people so that they can help someone. If you're serving someone and they end up in homelessness, you can help explain a little bit about what's this coordinated entry thing? Who do I have to call? What's that phone number? Where do I find this information? So those are some of the reasons why in your very busy life, work life, you need to think about like what role you can play in the CoC. Go to the next slide. So how do you connect? We talked about the website that they have that talks about the meetings that are posted, the agendas, the minutes. You can go to a membership meeting, you can attend a board meeting. And if you want more information about this, you can also contact Rosa, who is one of your CoC planners, to ask questions, see how you might want to participate in the meeting. So, okay, we'll go next slide. So if you're thinking about like, I can't commit to the board and I want to go to meetings, but I have a lot of meetings, what can I do? You can also just be part of work groups and committees, and again, lending your expertise. The point in time count that's done annually, typically always looking for volunteers. It's a big effort in a 24-hour period to count everybody in Rhode Island that's experiencing homelessness. Maybe your outreach team can volunteer. Maybe your case managers want to volunteer. Maybe you can help with any of the gathering and collating and all of that stuff. So there's a committee, I'm sure, that works on this, and you can be part of that process. It's one time a year, right? Like finite commitment. You can also bring in providers, right, that you're working with, and help them understand the housing and services. You can learn something at the CoC and then educate your partners who don't have time to go to the meetings about the housing and services that are available. There's those 9 committees and work groups. You could be on part of those. Maybe you're really interested in performance outcomes. You could participate in that. Maybe you're really interested in this front door, the coordinated entry, the intake assessment, and the prioritization and referral system. Maybe you want to talk about that because you're hearing from your clients, we don't know what to do, or we're never getting referred. Like what's happening? You might hear frustration in your group. So being part of those groups, you can lend your expertise about the client's experience and how your agency can be a partner there. And then supporting that annual application process. You can only dial in a little bit of the year, just looking at the questions that have to be answered. If you're an expert in any of the topics that HUD is asking in your CoC to describe, making sure that you're, very timely and very promptly submitting that information to your planners so they can massage it into the character counts and then submit it to HUD. So again, you get credit for all the good work that Rhode Island is doing. Okay, we'll go next slide. Just have a couple more slides and we're going to open it up to any questions that you may have. So creating partnerships, we'll go next slide. I've broken this into 2 different parts. So I wanted to think about partnership questions for leadership. And then the next slide, we're going to talk about direct service staff partnership questions. So what you want to think about is what time you have as the leaders of your communities, or maybe the leader of a housing department within your agency or project. What can you do to participate in this? Do you have time to spend? Do you want to nominate and be on the board? Do you want to nominate, or do you want to join a committee and do that work? Do you have funds that would support that time? Can you sponsor someone? Maybe you as a leader could say, you know what, I'm not the right person. I'm not in the day-to-day. I'm not hearing from people directly impacted by homelessness or interacting with this thing. Maybe you organize your team in a way that you can assign or allow a direct staff who is interested to be closer to those day-to-day needs. Thinking about as a leader what the organization can do to proactively talk to people about what roles they can play, and then giving the space within their job and their duties to participate in that and feel like they can be a member. As leaders too, you can stay in tune with your coordinated entry process for referrals and for intakes and assessments. It's really important as you're onboarding staff to make this part of the onboarding process so that they know when to refer clients, how to refer clients, how to support clients if they're been assessed but haven't been referred yet. And that's important because we want people who are already in a crisis and experiencing homelessness not to feel like they're being bounced around, right? If your staff has a better understanding of the coordinated entry process and how it works and what the wait times are, you can better help people go into it knowing what to expect and not feel like they have to keep asking the same questions and that they feel lost in the system. And some people may just walk away and not get the services they need. So really understanding at the leadership level what that process is, or designating a staff to understand that and making that, keep updated for your team. This last one's really important too. How can you step out of your silos and work better together as a whole system response, not a like, I get this money, so I do this, and I get this money, so I do this. When me, Melanie, if I'm the person experiencing homelessness, needs both of you, and I don't want to tell my story twice. How can you leverage your programs to partner with the CoC programs and the CoC to make sure that you have access to your services? The CoC knows how to do that. They know what the opportunities are. Maybe you could do a project together. Is there a way to weave those two funding sources together formally so that people have one place to go and they get both services they need instead of doing applications and intakes across agencies? And then this last bullet is a little bit nuanced, but it's how could current funds that your agency have help the CoCs meet match requirements and make your CoC more competitive nationally. So in past competitions, HUD has preference, like if you have housing units brought to the table by your housing authorities, that and it's part of your CoC program project, you're going to get preference. If you have healthcare centers or specific supportive services designated for other funding sources here, right? As leaders of your agency, and as designers of the programs, CoC program and other, you can think about like how can I be part of the bigger web to put Rhode Island CoC at the forefront and be as competitive as possible and meet the needs of people without having to go to 5 different people and tell their story. How can you create a more seamless system? So that's at the leadership level. Let's go to the next slide. We'll talk about kind of direct service staff. If that's the role that you have here today, you're one of the people that are providing direct services to people either experiencing homelessness or in another subpopulation. You can open the question, right? Like with your director or with your team, if you have team meetings, like, can we do this? Do we do this? Understanding what role you're already playing and understanding how you can give input. Like I said, the agendas are public, the minutes are public, reviewing those and seeing, is there a topic that the CoC is working on that you guys are also working on? And how can you give input and when and where can you do that? Can you help with that annual point in time count? Really opening the conversation with your management about what you're already doing. And if you don't have a role yet, what you could be doing. Same one here is I have for your leaders. What's the process for keeping up to date on coordinated entries and for the referral process and the intake process? Like at the staff level or at the design level for your teams, how can you keep track of how many people on your caseload are going through the coordinated entry process, have made it through the process, are waiting for a referral, got the referral? How can you stay up to date on the required and voluntary services that are using coordinated entry as the referral source to be able to get that resource? So thinking about if your agency hasn't done it or if your project hasn't done it, how can you organize your work to know that people are going through that process so that you can support them and understanding? And then again, service provision. How can you be a partner to help people navigate all the different applications that they have to do? If you're the case manager or the outreach worker, can you be an alternate contact for the person? Because sometimes the cell phone minutes run out. They can't get to their email for whatever reason, right? They don't have as instant access to information. You don't want people to miss an opportunity. And then most importantly, even though it's my last bullet here, is you are working directly with people who are experiencing homelessness, or they're at risk for becoming homeless based on what's going on in their life. How can you support empowering them to participate in the process? How can you support helping them understand the opportunities and where they can lend their voices to empower people to go forward? So those are just some ideas, and you can kind of think within your team other ways that you might be able to be part of your CoC. Okay. So that was, again, a lot of information. Thank you for sticking with us for this hour and a half. Now I want to hear from you. Like, we've told you a lot of information. I've told you some about what's required, what's not. Nicole just opened the Menti now. This is just an open. You can just type in a couple lines or keywords based on what you've learned from us today. What will you do next? What's one action item that you can commit to publicly? And then you can think of others that you might want to commit to privately. But if you can share publicly, what are some of the things that you're going to do next based on the information that you have today, either you specifically or just within your team? So we are going to give everyone, let's do 5 minutes to kind of put some ideas up here. And I'm just going to go on mute while you're doing that. Again, next time we're going to have music here, right? Like we're going to have some Jeopardy theme music or something like that for these moments. But let's take 5 minutes. So around 2:30, 2:31, we'll kind of go over these. So for all the brave souls, if you can go ahead and put in your ideas about things you can commit to, that would be great. A couple people responded, so learning more about CES, coordinated entry, and the HMIS system, right? What can you do there? Learn more about the HUD scoring system, see how your agency can be more effective. Absolutely. There are things to make your agency competitive. And then there are things to help your agency understand the performance measures and where you're aiming for, so you can work with your team about that. So those are great. We'll give another couple minutes for other folks if you want to join in. And we did make everything anonymous, so feel free to put any thoughts you have out there. Okay, someone put in partner agencies. Yes, who can you invite to join? Also, when you're thinking about membership, the pitch, right, is part of it. So if you're going to someone who's a partner to the homeless response system, but maybe not engaged in that day-to-day work, like start with a small ask, right? Like, here's a committee, or, can I pick your brain on this particular topic? Like, kind of slowly bring people in and find your champions in each of those kind of key areas where you want participation. Participation doesn't always have to be going to all the CoC meetings, or, being a board member for 6 years in a row. Like, there's a lot of ways that you can participate in the CoC that add value. I'm gonna give it one more minute if there's anyone else that wants to put an idea about what you'll do next based on this information. I'm just gonna look in the Q&A while we do that. I don't see anything there. And thank you, Nicole, for posting in the chat some resources as we went along. We'll give it just another few seconds, and then what we'll do is we will open it up to questions. And we have a very small group today, so we can definitely just have people come off mute, or if you want, you can type into the Q&A box and we can triage from there. last call. Going once, going twice. Okay, let's move forward. Okay, questions, thoughts, and comments. Love to hear from you if you have any questions or clarifications. Would love to hear if there's more that you want, if there's a topic that you want to learn more about, that we can pass on to the CoC as part of the training that they offer each year. Any questions from people about what we shared, or thoughts about what you want to know more about going forward? And again, we're a small group, so you can just come off mute if that is easier than typing out a question. Small but mighty but quiet group today, which is totally okay. If you think of anything, we'll go to the next slide. So as you're thinking, if you have questions, I put this slide in at the end. These are all the acronyms I tried to talk out as I was going along. So this is going to be in the deck so you can understand some of the different acronyms that you're going to hear as you become part of the CoC. We'll go next slide. Thank you for attending. And the next slide. This is how to get in touch with us if you have any questions. Also in this deck, you'll have the contact information for Rosa, who's one of the CoC planners, so you can get in contact with them also if you have any questions or ideas that you want to share with the CoC. So I'm gonna going once, going twice, going 3 times to see if there's any questions. If not, then we will give people back a little under a half hour of their day. And I really appreciate you attending today. We'll be sending out the materials and a survey to get your feedback to inform future trainings. And again, thank you so much for taking time today. If there's no questions, I think we can stop the recording there and close the session.
Thank you.
Thank you very much.
Thank you, everybody.